Marty, thank you so much for taking the time to chat with me today. It's a real pleasure. For those that don't know you, I wonder if perhaps we could start with a brief introduction to yourself and to Ardent.
Sure. Thank you very much for having me today. My name is Marty Bonick, and I'm the president and CEO of Ardent Health Services. Ardent is a hospital company that is based out of Nashville, Tennessee, and has hospitals in 6 states across the United States. We have about 1,200 providers that work with us, and a number of outpatient facilities and clinics, as well as our hospitals.
Fantastic. And the thing that I'm curious to ask you about first and foremost is you took the reins as president and CEO at a very testing time, I would imagine, in the heat of the pandemic. And so I think I'd be amiss not to ask you about what that was like. So could you talk to your experience of that briefly?
Certainly. I started in August of 2020, so sort of midway through the pandemic, but before really the large surge happened in the United States for most of the country. And I would say that that's certainly not the way that you would write your storybook entrance into a new company. But what I would say is I was amazed by the resiliency of our caregivers and how they had handled themselves and how they really adapted so quickly to just a worldwide pandemic without any planning, without any notice. They snapped to it. And so organizationally, we had to adjust as well. And so just as we're doing a video interview today, most of my introductions to the company were very virtual in nature also. I was fortunate to get around and see some of our facilities before the large surge of patients hit our facilities in the holiday period around Thanksgiving. But a lot of this has been virtual. And so I think the silver lining is our teams have adapted well. And for what I think a lot of business people experiencing in the United States, where it's certainly nice to be able to meet people in person and go to dinners and see facilities face to face, the video connection really has been helpful, and so I think this is something that will stay part of our business as we go forward. And if you think about the amount of travel it takes to get to some of our locations, I'd be traveling in the better part of a day to go somewhere to meet for a half a day worth of meetings and then spend another day flying back. And so I think we've found that we can actually be pretty efficient in a remote fashion and connect to each other in meaningful ways. From workforce development, I think the other silver lining is that we're realizing that if we can make this work virtually, well, then maybe we don't have to have everybody in the same location. And I think that will help us ultimately to drive additional efficiencies across our organization where people can cross market boundaries or state boundaries and help other facilities, as well as us to recruit from different geographies and not necessarily have to have everybody pick up their families and relocate, but can still contribute to the mission of the organization.
Fantastic. So it seems that the digital trend has opened up, say, quite a lot of opportunities. So could you speak to the digital health journey since you took over at Ardent and the ways in which, I guess, the care delivery has evolved, or indeed how the organization's operations have evolved with technology being part of that?
Yeah, absolutely. So I think like a lot of healthcare organizations, we've had to, again, pivot the way in which we've done things. We've very much been an industry of we've built it and expect people to come to us. And I think we're realizing as a result of this, we have to reach out to where people are and where they want to be treated, where they feel comfortable and safe being treated. And so we have always had, I think, a forward thinking mentality around our digital transformation and what we call our digital front door, but it really got accelerated through this pandemic period. Telehealth was already something that we were doing, albeit not to a great extent or a volume, but we went from 0 to 60,000 visits essentially, in 60 days, which is, kind of unheard of in healthcare. And I'm sure a lot of other organizations experience the same type of effect. But when we put our minds to something and are forced to do something, healthcare always rises in a crisis. And so That's a simple example of something that's happened, and hopefully something that doesn't go away. While we've seen those rates come down a bit from their initial peak, we're still 20,000 visits a month, every day, even after not every day, but every month after the pandemic or since the pandemic has started. And that's something that we need to embrace, because if we don't do that as health systems, somebody else will fill the gap. Walmart is out there trying to do things. Amazon is out there trying to do things. And these non-traditional healthcare players are trying to figure out how do they come in and provide value and reduce cost. And so as healthcare providers, we have to do the same. And so that's just one example in terms of how do we create accessibility through technology. But there's a service component to that. How do we help patients to schedule appointments online? How do we help them to check in online? How do we help them to find a caregiver and find care when they need it? There's so often that we want to schedule something, a patient wants to schedule something with a provider. And in healthcare, what do? It's like, well, that's great. We'll see you a month from now. Well, we live in this age where people expect instant gratification. And I don't wait a month for something from Amazon to ship for me. I expect to get it in 2 days. And if it's late a day, it's like, oh my gosh, how did that happen? And here in healthcare, it's just the bar of expectations is so low. We have to change that bar. And I think if we as health systems don't focus on that, then somebody else is going to come in and take those patients from us or find alternate ways to do that. So we're very much thinking about transformation as a permanent thing, and this is an accelerator for us, and I think a good thing for the industry ultimately.
Yeah. And you're right, there are bodies that haven't traditionally been in the ecosystem entering that ecosystem and potentially looking at taking a share of that market. And so with patient expectations changing and being more digital, you still need to, of course, provide care. There still needs to be an in-person element oftentimes. And so how are you approaching the challenge of hybridization, I suppose, or of multi-channel, where you have digital elements and physical elements within the new patient pathway?
Yeah, it's definitely, from my perspective, an and strategy. And I think a lot of people try to fall into this trap of, well, I'm going to either do inpatient or I'm going to shift to digital. And it's very much an and. As you said, people have to still have, at least in today's standards, face-to-face interaction, largely because of the testing and monitoring that we have to do with patients. And so there's this physical aspect of whether it's listening with a stethoscope, taking an EKG, a lab test, et cetera. But I think what we're going to see with some of these consumer disruptive technologies and even the main healthcare industry technologies is this realization that there is a shift. Our organization has gone to fully deploy Epic across our entire 30 hospital platform. We're finishing our last installation as we speak. But once we have all that information, we're going to be able to harness a lot of data that we need to turn into useful, actionable information to be able to drive the organization forward and drive better results for our patients. And so earlier detection of problems and symptoms through longitudinal tracking, I think, is going to be important as we move forward as an organization, and using that data to help patients stay healthier, to prevent deterioration in conditions, and ultimately provide a better patient experience. And so those are some things that we think about as we're thinking about this embracing the and in technology. But I'll tell you, I've come across some organizations recently that I think will transform how we care for patients even inside the organization in embracing that technology. So we now have information systems that are capable of collecting large amounts of data. And there's technologies now where with a simple patch, they can monitor most of your physiological conditions. And instead of just a telemetry monitor, which is what we typically would see, or a pulse ox inside of a hospital setting, that nurses have to come and take vital signs and all of these physiological data points every 4, 6, 8 hours, whatever the case may be. I think there's going to be technology, or it does exist today, that we've been exposed to, that you can record those vitals automatically, which is going to save nursing time, and then use computing power to from an AI or machine learning perspective, understand that this patient's condition is deteriorating. And if we're only collecting vital signs every 4 hours, and we're waiting for a human to understand when that patient's trend line is shifting, that's a lot of time that can transpire. However, if we've got a machine that is transmitting this data in near real time and doing it every 15 minutes instead of every 4 hours, the machine's going to be able to send an alert to the nurse, hey, have you seen this trend? And this patient is deteriorating. let's intervene and we can prevent a cardiac arrest or a disastrous situation for a patient from happening. And I think that's ultimately going to improve the care journey in that in-person environment.
Yeah, absolutely. So if I'm understanding you correctly, the pandemic has put a lot of pressure on medical staff, on nurses and physicians. And one of the upsides is how technology and greater access to data can maybe make more efficient patient journeys, which will liberate some of their time and efforts. Is that one of the positive things that's coming out of this pandemic?
I absolutely think so. I think healthcare has been a little bit late to the party in terms of the use of technology and computers in its day-to-day business. I can think of not so many years ago where we had still nurses and physicians charting on paper, and now as a result of the HITECH Act, most hospitals have transferred into some type of computer environment. But the reality is we're fairly new to that journey as an industry. And I always say when I'm rounding through hospitals and talking to doctors that are frustrated with the technology and it's not saving them time in their day-to-day roles today, I said, okay, you've got one of these in your pocket. Everybody's got a smartphone. I said, let me have that back. It's like, oh, no. I control my bank accounts through there. I can control my home through there. I can control my life through that phone. I need my phone. But healthcare is not as easy as it is to automate some of these other things that we've gotten to, but it will get there. And I firmly believe that as we now have a base of users, and literally all hospitals in the United States are essentially on an electronic medical record, there's universal standards that are being adapted and refined every day, that people are going to, the vendors, the software, the epics that we work with, are going to continuously raise that bar. And will it ever be as easy as my iPhone to use? Maybe not, but will it get better from where it is today? Absolutely. And I think that's the promise that we have ahead of us, but we first had to all get on a computer first. And if you go back to, date ourselves, the Commodore 64s to the IBMs to the Macs, this evolution that we've had in technology, we have to start somewhere. And in healthcare, again, I think we're relatively in infancy, maybe toddler stage in terms of our use of computerization, but the promise of what we can see in other industries, I think will translate, and that's ultimately going to provide better care for everybody.
Yeah, absolutely. We all have, whether we're providers or patients, we all have these incredibly powerful devices in our hand, and you've talked about some of the opportunities that comes from that. Does the role of the patient change? Are patients more empowered, and how does the patient provider dynamic change, or might it change in the near future?
Yeah, I think that's a great question, and another thing that's going to help transform our industry. There's been this doctor-patient relationship that's sacred, and I think that will remain. That people trust their providers, and over again in studies you'll see that doctor-patient trust is there. But historically, the knowledge gap was huge. I think with computerization, knowing your numbers, having access to your information and your health records is going to help patients to make better lifestyle decisions that they can understand and see progress as more wearable devices and patient tracking devices are connected to our smartphones every day. Patients are going to get that feedback. And so when their doctor's talking about, you need to go and walk, and what's the impact on your blood pressure, and you can track that at home and not just at a doctor visit, because you've got these devices that make it very easily for you to sort of track your numbers and see that when I'm walking, my heart rate comes down, my respiration rate comes down, my blood pressure comes down. And when I stop walking for a period of time, I can see those numbers going up. I think the digital connection for patients to have that information and learn about themselves in their pocket is ultimately going to make that bond with their physician stronger and more impactful when they can see in real time how the recommendations the physician may be making plays out. There's a number of devices now. Diabetes is a huge, population challenge for our health condition challenge for the population. Yeah, and now you've got wearable devices that instead of having to do the finger pricks and putting it in the manual machine and getting one result, you can put devices in your arms that you can wear for a week, and your smartphone collects that data, gives you feedback, tells you what to do, and then trends that longitudinally again. And you can see how these patterns and trends impact your personal life without having to have that continuous relationship and going back to a doctor and waiting for a check for them to come out and try to analyze that trend for you in the 12 minutes of time they have to spend with you and try to convey all that knowledge. So I think, the computerization and the input of consumers into their own health decision making is going to make for a stronger bond between patient and physician and better lasting results.
Yeah. And on the topic of restrictions of time, we probably only have a minute or so left. And so my final question to you, I suppose it's a big one, but what are your main kind of hopes and fears for digital health? There's a lot of opportunity, but are there some risks associated as well as we become more digitized in healthcare?
Yeah, the hopes are, I think, that our healthcare journey, our own understanding of our health and our ability of our providers and caregivers to interface with us will become as simple as a smartphone interaction that, a toddler can learn how to use. And we make it very easy and insightful and for something that people want to go and see and track and use. So I think that the hope and the promise is certainly ahead of us. The challenge, obviously, is the risk. When you aggregate large data, and particularly for health systems and payers, the cybersecurity threats and the risk of having all of this patient information now stored and people trying to access that for all sorts of reasons. It could be for intellectual property from a research perspective. It could be from financial fraud situations where people want to access large sets of patients' records and file false claims, against their names. There's all different cyber threats that we obviously see. We saw with the pipeline impact of the U.S. that had just cyber attacks and criminalization activities. When you put a large group of patients and a large group of data out there, that is probably the risk is how do you protect that information so it doesn't get in the wrong people's hands.
Yeah, fantastic. It sounds like there's a lot of opportunity, but we have to be cognizant of making sure we're capitalizing on that opportunity, not opening
Absolutely.
ourselves up to risk. Marty Bonick, thank you so much for taking the time to chat today.
Wonderful to speak with you. Thank you so much.